Hello everyone. So today we will discuss site approval for MTP, as in how to get your clinics, nursing homes or hospitals approved for the medical termination of pregnancy. All government hospitals, they do not require any kind of approval before MTP, but all private sites or the private hospitals, they require the approval for MTP. And the approval is given by the district level committee, which is appointed by the government. A word about the district level committee composition. Now, minimum there are 3 members and maximum there are 5 members, out of which at least 1 member has to be a woman. There is 1 chairperson who will be either chief medical officer or a district health officer. Then 1 will be gynecologist or surgeon or anesthetist. Then 1 or 3 will be from the local medical profession or NGO, Panchayati Raj institution of district, and the tenure of the district level committee is for 2 years. So if you apply for the approval for the MTP, you have to decide if you want the approval up to 12 weeks or up to 24 weeks. So if you want the approval up to 12 weeks, you should fulfill 5 criteria. That means there should be a gynecological examination or a labor table, then resuscitation or the sterilization equipment, then drugs and the parenteral fluid for emergency use, then backup facilities for the treatment of shock, and the facility for transportation. And if you are applying for up to 24 weeks, then in addition to these 5 things, you should also have operation table, then instrument for performing abdominal and gynecological surgeries, and then anesthetic equipment. Now the approval, it is applied in Form A, and you have to clearly specify if you want the approval till 12 weeks or 24 weeks. After the amendment, this column has been changed. Initially, there was up to 20 weeks, but now it is 24 weeks. So the centers who have already got the approval for 20 weeks, it automatically means 24 weeks. So they do not have to reapply for the registration, but then you have to get your form updated from the CMOs of your region. So here you have to take whichever category is appropriate for you, category A or category B. Category A, that is up to 12 weeks, and B is up to 24 weeks. Then place and date has to be written, and the signature of the owner of the hospital has to be done. Now, all the private sites, they will get the approval up to only 24 weeks, which means after 24 weeks, the MTP has to be done in the medical colleges. Then approval, it is given in the Form B. And here it will be clearly written up to 12 weeks or up to 24 weeks. Then the name of the place, then the address will be written, name of the owner will be written, and here the government seal and the signature will be there. So this is the certificate of approval, and you are supposed to display this certificate in your family planning unit. So once the approval it is given, it is permanent, renewal is not required, but the CMO, they can come from time to time for the inspection. And if they find that the place is not maintained properly, or if the MTP is not done under safe and hygienic conditions, or if they find if there was a death or an injury to a woman because of unsafe and unhygienic conditions, then they can seek any information. They can seize any article, medicine, register, or any document. And then they can recommend to the district level committee also. And then district level committee, they can cancel or suspend the registration. Now, briefly, how to go about taking the approval is that you have to apply a Form A to the CMO or a district health officer, and then CMO or a district health officer or any nodal officer, they will come within 2 months of receipt of the application for the inspection. And ideally, the certificate of approval has to be issued within next 2 months. If there is any deficiency noted with respect to record or the place, then that can also be rectified. And if after inspection, verification and the inquiry, if the CMO or a DHO, they find that the place is suitable, then they will recommend to the district level committee for the approval. And the district level committee, they will have the meeting, and then they will issue the certificate of approval on Form B. So this is how you should take the approval for MTP. Thank you so much for your patient hearing.